Welcome to the 12th episode of 5P Podcast, the first international regenerative medicine and anti-aging podcast that will give you the tools to age with the greatest health, wellness, and appearance. It is directed by Professor Dr. Jaime Rodriguez Quintosa and Professor Dr. Debbie Binsky. We are your hosts, Sandra Sola and Professor Carlos Galante.
We are at the headquarters of Jerry's Productions Wavesmith Studios, the podcast accelerator that walks you through the steps to create a successful podcast from scratch. We invite you to subscribe to our YouTube channel at 5P Podcast to learn more about this topic. As you well know, we have with us the 5P Podcast Ambassador, Professor Dr. Debbie Binsky, the Queen of Anti-Aging Medicine and President of the World Council for Preventive, Regenerative, and Anti-Aging Medicine, WOCPM. Welcome, Professor.
Thank you. Today we have the famous Dr. Miguel Martínez Del Campo. We like to start the same question to all our guests, but before I will introduce who is this handsome Dr. Miguel Martínez Del Campo. He is a medical doctor. He studied at the University of Barcelona to later open up to new branches. In London, where he lived 20 years of his life. He studied gynecology and women's medicine, also general practitioner. In Belgium, he began to develop, I think the voice is disappear. Can we repeat again?
Yes, you can start from
the introduction, because I think my voice, I cannot hear my voice, echo.
We can hear you.
We can see, we can hear you.
Okay. Just a moment, Tina start something, Tina. Atau nggak usah Tina, ini aja deh. Matikan itu. Okay, can I repeat again?
Yes, no problem.
Okay, all right. Thank you, Sandra. Today, we have the famous Dr. Miguel Martínez Del Campo. He's a medical doctor. He studied at the University of Barcelona to later open up to new branches in London, where he lived for 20 years of his life. He studied gynecology and women's medicine and also general practitioner. In Belgium, he began to delve into the world of anti-aging medicine. And finally, in Germany, he completed master degree in preventive and regenerative medicine. And he also vice president of the World Council of Preventive, Regenerative, and Anti-Aging Medicine in Paris. Dr. Miguel, how are you today?
I'm good, thank you, Debbie. How are you?
I'm fine, thank you. I'm well. And Dr. Miguel, we like to start the podcast with the same question to all our guests. Why did you decide to dedicate yourself to anti-aging medicine?
Well, that's a very, very interesting question, Debbie. It's not that I want to live forever, eternally. It's just that I want, whatever the time that I live, I want to have it with very good quality of life. I don't want to have bad quality of life. And I wish the same to my patients. So that's the reason why. We can do better as we are doing nowadays.
And Dr. Miguel, let's start with the interview. Let me start because I was. All right. Dr. Miguel, what are estrogens and which are their main function in the human body?
Well, estrogens are hormones that men and women have, but just women have 10 times more than men. So that's an important difference because it's a molecule, a substance that makes a woman being feminine. It's what will produce the shape of the body of a woman. But they have multiple functions. They have functions at the level of the brain, functions at the level of the skin, at the heart, at the sexual development, so the gonads. They've got lots of different functions in the hair. Let's say that they are substances that produce multifunction.
Okay. Oh, that's very interesting. During your lecture in the first International Health Conference in Bali 2023, your lecture was about the toxic estrogens as a key factor to breast and prostate cancer. How are estrogens related to the development of breast cancer?
Of course, natural estrogens, bioidentical estrogens, are good for our cells. Our cells require bioidentical estrogens, mainly female cells. But unfortunately, as a degradation product of these estrogens, there are produced substances that are toxic for the body. So if these substances called toxic estrogens are not, the body doesn't get rid of them, we will increases the risk of developing certain cancers and diseases. For example, breast cancer or endometrial cancer. So that's the reason why it's important to get rid of them. And everybody produces these estrogens, toxic estrogens. The important thing is to so the body to get them out of the system.
And how this hormonal imbalance could increase the risk of breast cancer?
Well, the risk of breast cancer, there are lots of different things that increase the risk of breast cancer. So there are statistical things that can increase the risk of breast cancer. For example, having an early menarche, so first menstruation or late menopause. But from the point of view of hormones, we know if there are two hormones that have to have a right balance in women. And these are estrogens and progesterone. And in men, it's testosterone and progesterone, also with estrogens. They need to have a right balance. Because otherwise, if they are unbalanced, so if we have more, let's say, effect of estrogens than progesterone, then is when risks appear. So there is more risk of breast pathologies, also ovary pathologies or uterine pathologies, and there is more risk, of course, in those pathologies of cancer. And the same in men. In men, if there is no right balance between testosterone, estrogen, and progesterone, there will be appearing pathologies like prostate hypertrophy or prostate cancer.
Okay, so you also talked about body detoxification. Could you explain how the body detoxifies?
Well, all the cells of the body detoxify. So every single cell, once they use products, they produce, let's say, rubbish products or garbage products. So these products, they are collected by the liver, that is the machine that, let's say, grabs all the toxics and throws them to the bin. So the liver is this important organ that is going to be able to detect and send those toxics to the machines that are going to get them out of the system, like the kidney, the stools, the sweat, the lungs. Yes, but they need to go through the liver first.
And what are the symptoms of a possible hormonal imbalance in men, for example, that could alert that everything is okay with their prostate?
Well, that's a difficult question because symptoms is what you feel, okay? Signs is what your body shows. Mm-hmm. And then we have complementary examinations, so blood tests or scans. And not always we feel things. So you can feel, for example, if symptoms of a big prostate can be, for example, reduced urine flow. So I don't have the flow of urine as strong as when I was 20. Or I finish urinating and then I need to, after a while, I need to go back to the loo because otherwise I have an empty in my bladder. Or I need to get up in the middle of the night and urinate 2 or 3 times a night. So there are symptoms of possibly a increased prostate size. Now, but that's that's already having the disease. Can we detect early if we are going to have that problem? Yes, we can. Is it going to give us any symptoms? No, it's not. So one thing is checking for the PSA, the prostate-specific antigen, and another thing is checking for the balance of the hormones that we talked earlier, like the estrogens, the progesterone, and the androgens. So that's predictive medicine and preventive medicine.
Thank you, Dr. Miguel. And I think that's very important for the balances of the hormone, both in men and women. And since we have the expert here, we'd like to ask the question, what do you think, Dr. Miguel, what methods exist now, the up to date, to evaluate hormonal imbalances in men and women?
Well, we've got the ideal situation would be to know what's happening inside of the cells, but unfortunately, we don't have that technology yet. I'm sure that one day humanity will have it.
Yeah.
But what do we do nowadays? So we do blood tests, we do urine tests, we do stool tests, and then we do complementary examinations like ultrasounds, we do CT scans, PET scanning, and we'll do all those things. So first things first. So first we do a blood test, a urine test, and a stool test. And with that, we can practically cover most of the things. So we know if there are increased risks of cancer, prostate cancer, breast cancer with all those tests. And then we will move on to complementary examination. So we'll do a mammogram or we'll do a prostate scanning.
Thank you.
Thank you. We remind you that we are interviewing Dr. Miguel Martínez Del Campo. He is a medical doctor specialist in gynecology and women's medicine. He is also a cutting-edge doctor in anti-aging hormonal treatments worldwide. You can find out more about his work at his website at clinicaantiaging.com. If you're enjoying this episode, don't forget to subscribe to our YouTube channel at 5P Podcast. So, Dr. Miguel, can diet and lifestyle influence estrogen levels and cancer risk?
Yes, indeed, it can. For example, let's talk about nutrition, or things that we do every day that are not good for our hormones. So if you eat an inflammatory diet, so that means you eat fast food, overcooked, too many carbohydrates of the bad ones, let's say, of starches and bread, pasta, rice, etc., you're going to produce an environment that is going to make cancer cells easier to live. And if then that will go into, is like the pathway to disease. So for that reason, it's important to eat a healthy anti-inflammatory diet. It's basic. Like also practice exercise, moderate exercise, and also reduce the toxic load. For example, if you are used to drink water from plastic bottles, that's dangerous. Why is that? Because plastic contains molecules that are similar to estrogens, but bad estrogens. So people that tend to drink from plastic bottles are increasing the risk of developing not only breast cancer, but prostate cancer and other type of cancers. So very important, those three things: anti-inflammatory exercise, toxic load control, and of course sleeping well and stress control, because excessive stress is going to produce also increased toxic estrogens.
Oh, interesting. Thank you for the very good tips, Dr. Miguel. And what do you think about diets that help to restore hormonal imbalances? and what are they based in?
Okay, David, thank you very much for this question. As you know, we can have a perfect diet,
Yes.
but menopause will still happen. So we cannot stop what the nature has for us predicted, let's say. But we can delay it, and we can improve our symptoms of hormonal imbalances. So for that reason, it's anti-inflammatory diets. It doesn't matter. Anti-inflammatory diets, there are lots of diets there, but anti-inflammatory diets, basically eating well is very simple. Eat proteins well cooked. So that means your chicken, your meat, your eggs should not be cooked over 150 degrees centigrade. That means it has to be or raw or boiled or steamed or oven cooked no more than 150 degrees. Eat your vegetables, different vegetables, mainly leaf vegetables, spinach, salads, and eat your oils or your fats, good fats, nuts, olive or avocado or other oils in good quantities. That's a good anti-inflammatory diet. If you do that, you have less possibility of developing nasty menopause or premature menopause. But it will not stop you from having menopause.
Okay, thank you.
Wow, it's like so amazing and so interesting, everything, because I'm thinking right now about my diet. And it's like, oh, I need to delete this or change that. Oh, I want to delay my menopause. So, is there any micronutrient that helps to detoxify the body?
Oh yes, there are, Sandra. There are lots of micronutrients. Don't forget that our liver eats every day. And what does the liver eat every day? It eats vitamins, it eats minerals, it eats amino acids, it eats fatty acids, and it eats bioidentical hormones. So every one of these substances is going to make the liver to work better, and so to every single cell of the body. But if we have to particularly see the minerals and the vitamins that are important for liver detox, we have to talk about magnesium. We need to talk about copper, zinc, selenium. We need to talk about vitamin B1, B6. We need to talk about vitamin C. We need to talk about taurine, an amino acid, glycine, another amino acid, and the major detoxifier of the body. It's called glutathione. Glutathione, very important molecule for detoxification. We can talk also about alpha lipoic acid. So there are different micronutrients that are very important for detoxification. But as I said, it's a whole. There are lots of other things that are going to influence that.
And Dr. Miguel, let's talk about the treatment of hormonal imbalances. How do you treat them?
Well, it depends on the hormonal imbalance. There are some hormones are taken in tablets, some hormones are taken in gels or creams, and some hormones need to be injected in subcutaneous injections. They can be injected also intramuscularly, but it's more painful. And we can also have implants of some hormones, like testosterone or estrogens. They can be in that way.
And do you use nutritional supplements?
Yes, I do. And I think it's necessary. Why is that? Because even if you eat perfectly, it's impossible to obtain the necessary amount of nutrients that the cells require to function the closest to 100%. So for that reason, we need to help nutrition with supplementation.
And what do you think about antioxidants like resveratrol and using this kind of supplement, antioxidant as a supplement? Because usually it's said that its bioavailability is like a concern because it said that the absorption is deficient. What do you think about that?
Well, no, resveratrol usually, in my experience, gets absorbed well, and it works very well. In fact, where does resveratrol come from? It comes from nature. Okay, so why is resveratrol produced? It's produced by certain fruits and plants in order to protect themselves from ultraviolet light, so UV light. And this is the pigment, for example, in grapes, in dark grapes, or blueberries. This is the pigment that they produce. And so all we do, or the pharmaceutical industry does, is to collect that pigment, that substance, in enough dosage so it has a good effect in the body. Because as you can understand, if we were to take the amount of blueberries or grapes in order to obtain the enough quantity of resveratrol to help us in health, it would produce other problems. For example, how many glasses of red wine should you take in order to get 500 milligrams of resveratrol? Well, 5 bottles a day. So 5 bottles a day, probably
Okay, all right.
you will make you will not make it far. Alcohol will kill you before.
Yes.
So it's better to take a simple tablet of 500 milligrams
Yes.
of resveratrol to get the benefits of resveratrol. But resveratrol is a very important molecule. It's an estrogen modulator, so it modulates the estrogen receptors. It improves the detoxification of toxic estrogens. It has got lots of different good effects in the body.
Okay, thank you.
So we cannot drink 5 bottles of wine every day. Sad.
Unfortunately, if you like, you can, but it's going to be against your health.
Yeah. So many people say that using hormonal replacement therapy is not recommended because, as you said before, it's a physiological phenomenon that hormones decrease while we age, for example, like menopause. What does the evidence say about this?
Well, I fully agree. Hormonal replacement therapy is not good. Because usually when we talk about hormonal replacement therapy, we are trying to replace a hormone that we already produce with some other hormone that is not in the body. So hormonal replacement therapy usually uses non-bioidentical hormones. So I am against that. What we do is hormonal, not replacement, but restoration therapy. So we restore the levels that they have dropped in the body with the same molecule. So what we do is hormonal restoration therapy. And we want to put those levels to optimal levels of health. That is the same thing to say optimal levels of youth. Okay, so we want to have our estrogens, or women estrogens, to the same level when women were in their 20s. Even if you are 50 or even if you are 80. That's what we want to do. Because that is going to reduce your risk of developing diseases, important diseases like atherosclerosis. And remember that atherosclerosis is, the next step is heart attacks or strokes. It's going to reduce your risk of depression, of dementia, Alzheimer's dementia, and osteoporosis. But in the meantime, you're going to feel better. So if you don't have them, you're going to feel worse. I mean, apart from your body is going to change in shape, so you're going to start putting weight, accumulation of body fat in your belly. You're going to lose your bottom, so the brown bottom is going to disappear, and your breasts are going to drop, and fine wrinkles are going to appear. You're going to lose hair, and you're going to say goodbye to sex. You will not have libido, and you will not have energy, and so if you're going to go through that, please, you're welcome not to take bioidentical estrogens. But if you do want to avoid that, then it is advisable to do them in a correct way. And bioidentical estrogens are very easy. They are applied in a gel form, never through mouth. We need to apply in gel, implant, though implant has got their problems. So gel form is easy.
Okay.
Thank you, Dr. Miguel. Yes, it's very interesting. And don't forget, Dr. Miguel Martínez Del Campo is the Vice President in the World Council of Preventive Anti-Aging Medicine in Education. So very well, you educate all our audience and also us. And I agree, we signed a consensus before in Paris, WOCPM, about this called hormone restoration and bioidentical hormone. Thank you very much again, Dr. Miguel Martínez Del Campo. Finally, what advice would you give to our audience who are interested in exploring if they may have hormonal imbalances and are planning to do the hormonal restoration therapy?
Okay, first of all, don't do it yourself. Go to a expertise, to a doctor that knows what they are doing. This is important, and there are not too many doctors that know about this well. We are trying to make arrive these to as many doctors as possible, but unfortunately yet there is a lot of work to be done. So go to an expertise. Follow your expertise advice, always with your priorities. So your priorities are the most important things. So if you have menopause, your priority is menopause. So everything should be addressed with that by the hand of an expertise. That's my advice.
Thank you. Thank you, Dr. Miguel Martínez Del Campo. So everybody must always listen to this podcast, 5P podcast. And today we have interviewed Dr. Miguel Martínez Del Campo. He's an outstanding doctor, specialist in gynecology and hormonal treatment, hormonal restoration therapy. He combined his medical practices with teaching all over the world the most cutting-edge technique to restore hormonal imbalance. Thank you, Dr. Miguel.
Thanks to you, Debbie. Thanks to you all.
Thank you. And thank you for listening and supporting this initiative. We invite you to subscribe to our YouTube channel at 5P Podcast. If you want to learn how to make a successful podcast, subscribe to @Wavesmith Studios on YouTube.
And as you know, see you next time, and remember,
Take care of yourself today to defy time tomorrow.